Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Did you know that all medicines have side effects? Yes, those medications that you're taking, whether it's for high blood pressure, diabetes, or malaria, every single drug that is on the market has side effects, and that includes herbal products. With me in studio, I am pleased to host two ladies who are championing the fight against drug misuse on raising awareness about the effects and side effects of medications on the market. We have Dr. Nambasa Victoria, a pharmacist by training, works with the National Drug Authority. You're most welcome to the show, Dr. Victoria.
Thank you, Darius.
And as well, we have Mrs. Kamoga Regina, a patient who is here to tell us about her experience with medications and side effects, to raise awareness about drugs, and more importantly, to tell us, to give you, the viewers, a patient's perspective on drugs and side effects. So most welcome to the show, ladies.
Thank you.
Yes, yes. I'm your doctor for the evening, Dr. Darius. So we'll just, first of all, before we dive into the topic of side effects, maybe the public would be curious to know about what you do, why you are advancing this, raising this awareness about the drugs and the side effects. We can start with you, Mrs. Regina. Could you tell the public why this issue of drugs and side effects is so important to you?
Yeah, thank you very much. I'm delighted to be here. I work for Community Health and Information Network. I'm the executive director. It's an organization that promotes the empowerment of people living with AIDS, malaria, TB, and non-communicable diseases. I'm also the chairperson of the Uganda Alliance of Patient Organizations. But I'm also a patient safety champion of the WHO Patient for Patient Safety Program, who promotes patient safety and ensuring that patients are not harmed in the process of receiving care.
Okay, so a very important person in the studio telling us about, not just about the patient perspective, but also raising the awareness to all, both health workers and the patients themselves regarding issues of drugs and policy. So how about you, Ms. Victoria?
I work with National Drug Authority. This is an agency that is responsible for ensuring that the products, the drugs we have on the market are safe, efficacious, and of good quality. So basically that's our mandate. And specifically, I'm the manager, pharmacovigilance. I know that's a big word.
Yes, but I think people don't know what it means.
To make it simple, pharmacovigilance deals with safety of medicine.
Given your position of pharmacovigilance, that is drug safety. So the first question I think people might be or will be interested in knowing is, why do drugs have side effects? Why is that so? We thought the drugs we take are meant to treat the condition, but now you hear they have side effects. So why is that the case?
Thank you, Darius, for that question. Just to remind us all that drugs are active molecules. They are not like ordinary commodities. So the mere fact that they are there to treat a condition, they have to be active. So by being active, it means they work in a particular way, but in the process of working, they can also cause effects that were not intended.
Okay.
So that's why we say all drugs, even the simplest of, because I hear many times people say Panadol doesn't have side effects. Herbs don't have side effects. If a herb doesn't have side effects, then it's not, a product that can heal you.
Okay.
So it's that active or the chemical component that makes it unique, and that's why, much as it has the positive, it comes with some
it has a
minimal
negative.
risks.
Okay.
Yes. The beta is, even that's where the regulator comes in. Once a drug is developed, it is studied to look at the beneficial aspects, and then we study those risks.
Okay.
And then there's always that balance between the benefits and the risk, and we try to minimize the risk.
Okay.
So the risk can come because of the chemical component of the drug, or the risk comes as during the use of the drug. So I think later we'll discuss all those
we
aspects.
shall discuss it.
Yes.
All right. So, Mrs. Regina, in your profile you say you champion patient safety regarding medications. So, in your experience, what is the story like for patients when it comes to drugs and side effects?
Many times they assume it is safe, but of course, in the process, they realize that it's not the case, because medicines give them effects that are not desirable, or probably what they didn't expect to get from these medications. I personally, I have high blood pressure, and I take medications. I take Nebulong and Telemestan. But one time, it was just a change of the brand of the medicines, and the side effects I got from just the change of the brand with a very severe headache. It was something that I didn't expect, but I went to my doctor and explained. So it's important that patients understand that, just as Victoria said, that these medicines, they are good, they have those active ingredients, but they can bring side effects. So the most important issue here is for the patient to know and also to ask questions when they go to see the healthcare professional, their doctor, when they're giving them the medicines. And coming from the Uganda Alliance of Patient Organizations, we have patients from hepatitis, HIV, sickle cell, epilepsy. We are interfacing with all these different people with different conditions, and they come reporting different side effects. So the whole point here is the relationship between the healthcare provider and the patients, because some of them are very ignorant and they may not be able to tell whether this is actually a side effect, and may actually run to go to a healthcare facility actually to treat a side effect. So the whole issue is about empowerment of the patient, the discussion, the relationship, to improve the relationship, so that we don't fear you as the doctor. You don't treat us as, you're the God and we are the, the small gods.
We know all drugs have side effects, but does everyone get side effects? Will everyone get to experience the side effects?
Not everybody will get side effects on a particular drug or at the same time, because there are several factors that we know would predispose somebody to most of these side effects. And maybe just to highlight that most of these side effects are mild, and they are not like common. Okay. Some may be serious, but there's this paradox of few and many. Maybe I will explain that. There are rare serious side effects, but there are so many of us who are taking drugs. So when we are so many taking drugs, and when you add up that, you see so many side effects. You understand that paradox? So because
I don't know. So there are very many people who experience side effects.
No, there are very many people taking drugs.
Yes.
Much as there are fewer side effects.
Okay.
But because these few side effects are happening in people so many people are taking drugs, so you will see the side effect to seem to be high, the number of side effects.
Yet they're actually mild side effects.
Fewer.
There are few side effects.
Yes, so that's a paradox.
Okay.
So that's why we are saying, because almost everyone is taking drugs, at one point will experience a side effect.
But then briefly, I know she'll come to the point of how do you tell this is a mild effect, this is a severe side effect. But generally, what factors can predispose someone to getting side effects?
So there are several factors. First of all, we have age, the extremes. So young children are prone to side effects because they are growing, their organs are growing. Then we have these older people who are almost shutting, their systems are shutting. So even a normal dose might tend to cause a side effect because the kidneys are really tending to deteriorate. So they may not manage to
they may not
excrete
manage the drugs.
the drugs. So
Okay.
chances are an elderly person might get a side effect that somebody like me might not get because of their age. Then
so,
we have
okay, so shall come back shortly to explore the risk factors for getting side effects. So you've had it, age can play a very important role in experiencing side effects. Children generally, because their organs are fairly young, they may not be able to process the drugs in the body. And for elderly people, because, well, your organs are tired, so we also have to adjust the medications accordingly so that you don't experience side effects. But more about side effects and who is at risk of getting them coming up after the break. Send in your questions and comments on our social media platforms. Always happy to hear from you. You're listening to The Doctalk Show.
You are watching The Doctalk Show.